This conference will now be recorded.
Okay, you're welcome to continue the board meeting now.
Thank you so much, Tessie. We'll move to operations reports. Please, Ms. Stephanie Luca, Executive Director, will now present the operations report.
Thank you, Dr. Schottenstein. Good afternoon, board members. Operations report of note, we still do not have a return to work date for office work. So we are still all working remotely, doing the very best we can. I think that staff productivity actually remains high, and it's definitely challenging. We're working through those kind of logistical challenges with mail and phones, and we're getting to the point with equipment where we might need to make some equipment adaptations, but just normal wear and tear sort of things. So we're 6 months in and doing well, I think. With being remote, I think there are some of us who are longing for a return to work, but maybe not everyone. We will be, over the next month or so, sort of scoping out the complexities of caregiver challenges for those who have young children who may be doing learning remotely, or who may be doing hybrid type learning situations. And so just know that we're going to be working through those challenges. We want to be flexible, but we also want to make sure that, if employees are working a full week, that they're able to work a full week. So we'll be working with our employees to make sure that they can meet those challenges, that we're all seeing here with the pandemic. And we are still officially on a hiring freeze, so not much to report in the HR status. With respect to finances, I know Dr. Schottenstein will give an in-depth finance report. I'll just mention that we're continuing to work on our budget materials. So as I think I said last month, budget submissions for boards and commissions are due September 15th. And that's for the next biennium. So that's starting July 1 of next year. So the way the process is working here internally is that we've pushed out requests to our leadership team internally to ask them what their budget requests are and needs are, as well as potential savings that they maybe can identify. And then we've also put out a call for language items that we can submit through the budget portal. I'd really like us to, in starting with this budget, really get strategic about the way we're creating those budget submissions. It's interesting. There's only so much money that we have, right? But I don't think that necessarily lends itself to a copy and paste of what previous submissions have looked like. I think that we need to really, especially in light of all of the work that we have going on right now, as a result of the working group report and as a result of the FS&B report, some of those things that we will discuss, I think we really need to start talking through what our priorities are and how we meet those priorities. And some of that is fiscally through a budget request. We do have about a $5 million cash balance. Dr. Schottenstein will talk about that a little bit in the finance piece of things. We are down in our renewals right now because of the emergency law that was put into place that allowed licensees the additional time this year to renew their licenses. So we have about 14,000 licensees that should have renewed between the start of the pandemic and today that have not. They will have to renew by December 1st unless they're granted another extension. I do not think that another extension will happen. I mean, I could be completely wrong. We've heard there's been no talk of another extension for those licensees. So we do expect that revenue to come in. It's just going to be coming in later this year. So given our cash balance and given our priorities and our possibly staffing needs, possibly some technology needs, we'll be looking at all of that as we put together our budget submission, and we'll be sharing more on that with you at our September meeting. The way the September meeting works, we'll have time to talk with you about those requests before we finalize our submission on September 15th. So expect kind of a full debrief on what we plan to submit for budget in next month's operations report. And again, the managers are having some input this year into that with respect to what some of their needs look like on the front line. Other pandemic sort of related news. We do, I think I might have shared with you last month, our exempt employees do have 10 mandatory cost savings days that they have to take this year. So that's a pay reduction, but some time off. So it's those 10 additional days off. We have a labor management committee meeting coming up next week, I believe it is, with the union, and they have asked us to implement a voluntary cost savings day program for them. That's common. That was done the last time the state did cost savings days. We had folks enter into some voluntary cost savings days. And, typically what I've seen in the past in other agencies is some of our more tenured employees will take that additional time off. And, it's just as they sort of they might be saving some of their vacation time and they'd rather than take some voluntary cost savings days. It's very normal that this would be a request. And I know other agencies have enacted these voluntary programs as well. So we expect to talk through that with them, and that may also help some of our caregiving challenges additionally for some of our union members. It's a little additional time off for them. New in your report this month are 2 bar graphs. And those graphs, last time we talked, I had explained that we wanted to do something to summarize that open and closed complaint data for you. And what we've provided to you this month are 2 graphs. One is, the first is the open complaints. It's on page 8 of your report. And it's just a month-by-month breakdown of our total number of open complaints that we have. We did exclude one licensee who has numerous complaints that were a similar complaint. We counted that as only one complaint because it really skewed the data. So, on average, over a 7-month period, we have about 1,850 open complaints every month. Some of those obviously carry over from month to month, others close and others are new. On page 9 of your report, you can see that over a 7-month period, we're averaging probably, I think, about 550-ish closed complaints a month. Some months, we have a little more variance in the closed complaints than we do in the open complaints. But I think the sum of the story is we have a lot of open complaints, and and if you look at the breakdown on the graph, we have a pretty static chunk in enforcement, we have a pretty static chunk in investigations, and we have a pretty static chunk in standards review every month. And I think this addresses some previous comments that we've had from you as members as to really what takes so long on some cases, or why do we not see things move through rather quickly? We have a lot of volume, and my 6-month review of this is I think we have some practices certainly that we need to look at and change and really sharpen. We've already implemented some new processes in Salesforce where we've asked people to be more timely in updating their cases and touching their cases. We're already seeing that some of those process improvements pay off. I think you've seen more sites and settlements over the past couple of months in your board activity. So we are seeing an uptick in that productivity just by nature of just general kind of complaint management. But I do think we need to really consider, and this is what we'll bring to you as budget requests, we really do need to consider the sheer volume, and if we have concerns with timeline issues, we really need to look at our staffing. And so again, we'll bring that to you, a well thought out sort of data-backed proposal when we come to you with a budget request in September. But I don't think any of us love the fact that 1,800 open complaints is our average every month. Let's see. That's about it for me from the operations report, but I'm happy to answer any questions you may have.
Okay. Thank you so much, Stephanie.
Sure.
Appreciate it very much. Ms. Jill Reardon will now provide an update from yesterday's Dietetic Advisory Council meeting, please.
Thank you, Dr. Schottenstein. Dietetics Advisory Council met yesterday, obviously through technology. And one of the things that we did have a quorum, one of the things we discussed was redoing the FAQs for all of the different advisory councils and starting with theirs. And we got some topics from the members of things that they were interested in specific to their fields for us to meet with in October. And that's something we'll work on over this next month to get back with them. And then just as a note, the Physicians Assistants Policy Committee meets on August the 21st.
Okay, thank you so much. Now I will give the Sexual Misconduct Committee report from this morning's 8 o'clock a.m. meeting.
Dr. Schottenstein, Dr.
Yes.
Schottenstein, I think we have an error that the rules didn't get put into the script. So I just want to make sure we don't forget that.
Thank you. I was actually wondering about that, but thank you so much for mentioning that. So the Strauss Working Group met this morning. The Sexual Misconduct Committee meeting group met this morning. And, you know, the Strauss Working Group recommended changes to the board's confidentiality statute, the 4731.22F5, and we discussed those matters this morning. The discussion revolved around 3 main areas. The question of our ability to release information for good cause, or release information if there's a threat to public safety, and also the question of whether we should place a time limit on confidentiality issues. So we had a thorough discussion regarding those matters. Regarding the non-F5 legislative proposals that we've, that we have sent out to stakeholders, we're starting to get some feedback from various boards, prosecutors associations, the attorneys general, medical associations, and such. We're getting helpful comments, and we're going to continue to work on that as well. We also reviewed the FSMB tracking spreadsheet that the staff put together for us that's color-coded. I thought it was done in a very efficient way, really breaks things down for us very nicely. And so that basically concludes my report. Thank you. Next, Dr. Sohn will present the policy committee, please.
Thank you, Dr. Schottenstein. So obviously, policy committee met this morning. We went over our minutes, rule review update, and we reviewed CSI action. And as policy committee is, we discussed several legislative matters. And to briefly summarize, we talked about House Bill 679, the telehealth initiative, and there'll be a separate telehealth committee meeting after the board meeting to discuss this matter. But so you know, multiple board members who make up the committee have met between this meeting and the previous one to discuss the initiative. But as far as we know, that bill is out of the House and in the Senate, and no committee has been assigned at this time. The other bill we talked about was Senate Bill 246, the medical licensure bill. And Chelsea Wansky is our new board representative for legislative matters. And we discussed with her our expectations going forward. And I just connected with her on break on some expectations that we have on board members. And specifically, we'd like to see 2 deliverables. One is a master list bill tracker that goes over all of the bills that may have an impact on the practice of medicine or the medical board. In that master list, we'd like boiled down in bold 3 sections. One is a description of the bill with bill number. Secondly is where we're at in terms of whether it's in committee or how far away it is from becoming law. And third is what the medical board's official stance is, in addition to other things that will be in that report. The second deliverable will be an immediate action bill report, similar to what you guys saw today with just 2 bills listed on there. That will likely be copied and pasted just from the master list, but easier for board members to digest when we discuss it. Another thing that was discussed and actually brought up by Dr. Feibel in the meeting was the hydroxychloroquine bill that went yesterday from from Representative Grindell, and we discussed how, just given some of the actions that are going on now with us and the Board of Pharmacy, that bill may not exactly go anywhere given the timing of us entering lame duck, but it leads us into the next topic we discussed at policy committee, which was the hydroxychloroquine issue with the Board of Pharmacy. And we discussed 2 options that board members had discussed with the Board of Pharmacy, and eventually settled on option 1, and basically to suspend or rescind the rule that the Board of Pharmacy was working on. Stephanie, our executive director, will be following up with the Board of Pharmacy with our opinions on option 1. And at the same time, we did discuss with her potentially talking about some follow-up, more of a global discussion on the role of the medical board and Board of Pharmacy. And just as a specific example, Dr. Feibel had brought up a point, and something that I've seen in my practice as well, is sometimes pharmacists are, for example, not allowing prescriptions of opioids for post-op surgical patients that have suffered significant trauma, even though it is allowed in the rule. And perhaps Board of Pharmacy could assist us in educating their pharmacists on the rule, or even, sharing with them the draft rule, just so that we're all on the same page and everyone's following the rule to maintain patient access. And that concludes my report.
Okay, thank you.
Oh yeah, sorry, thank you. I actually forgot about that. Yeah, the CME rule amendments. So we need a motion, or what should the motion be, Ken?
To approve amendments to Rule 473110-02 A1C, A2B, and to delete paragraph A3 and provide that information to CSI.
So moved. Second.
And looks like, yep, we have a motion and a second. All in favor say aye.
Aye.
Any opposed? Okay, hearing no opposition, that motion carries. And now this concludes my report.
Would now be a good time to get into those rules,
Sure.
the detox rules.
Okay, that would be great. So
Yeah.
we, on July 23rd, we had a very large package of rules that was heard by Greg Porter, our hearing examiner. And those rules are also going to JCAR on Monday, August 17th, for the JCAR meeting. And we did receive a number of comments that I'd like to go over with you. So most are technical, and then the comments regarding the detox rules are a little bit more substantive. So I'm just going to follow our memo. And it was revised yesterday with some additional comments from the Ohio Department of Mental Health and Addiction Services, and you'll see the revisions highlighted in yellow. So first we have 4731-1101 and 4731-1114. And this was a correction to the chronic pain rule to allow for some additional specialists to prescribe at higher limits, including oncologists and hematologists. So we did receive a comment from the pharmacy board that the rule that we were referencing in 4731-1101 regarding controlled substances has been changed. And so I have a recommended action to modify 1101A and B to include the new pharmacy board rule. And we can handle all these at the end if you would like. And then next, we have 4 rules related to detoxification. If you'll remember, the office-based opioid rules and a rule on naltrexone went through last year, I believe. And then we knew that we had the detox rule that we needed to do for PAs and for physicians. The nursing board is doing something similar for nurse practitioners. So we'll communicate any changes that we have to them. So we received 3 substantive comments. The first was from Zach Holsifel, who is Vice President of Hicks Partners. And in 4731-3302F5, he had, we originally had that the physician shall recommend that a patient who is successfully treated for alcohol withdrawal symptoms enter a long-term treatment program to maintain abstinence. So that was our language. The proposed language borrows from the language around opioid use disorder and indicates that the physician shall refer the patient to an alcohol treatment program licensed or certified by the Ohio Department of Mental Health and Addiction Services to provide the treatment, or to a physician, physician assistant, or advanced practice registered nurse who provides treatment using naltrexone or other FDA-approved forms of medication-assisted treatment for alcohol use disorder. And then it also includes that the name of the program physician, physician assistants, or APRN to whom the patient was referred, and the date of the referral should be documented in the patient record. And then flipping over to the next page, which I believe is page 3, because this involves the Ohio Department of Mental Health and Addiction Services, and because we've worked really closely with them on this rule, I did run this change by Rick Masati and Dr. Trevino at the Ohio Department of Mental Health and Addiction Services. They indicated that these proposed changes were satisfactory from their clinical viewpoint. They recommended taking out the word naltrexone and just have provides treatment using any FDA-approved forms of medication. I will point out that we do have a whole rule related to naltrexone, and we do use that word in 4731-3304. But I think that, this also is, makes sense. So I don't have a strong opinion on that. But I did just want to point that out to you. So I don't know if we want to stop here and talk about this particular comment, and you can let me know what your thoughts are with respect to that language change.
Yeah, I have a question. With us having a rule that specifically lists naltrexone, do we have to change that or do anything different as a result?
I don't think so. But we will look at that.
The current language, if you strike naltrexone, it does not exclude it. So
Right.
all it does is increase flexibility. So I suspect you're probably in good shape. Any other comments on that? I think it's a reasonable change.
Okay. All right. Great. Thank you. The next change that we had, the comment came from Henry Vandenberg, Senior Vice President at U.S. WorldMeds, and he recommended a change to Section D10C3 of 4731-3302, and then also 4734-02, which is the PA rule. The language is the same. And that language initially indicated that in withdrawal management programs of 30 days or less, the physician shall not allow more than 1 week of unsupervised or take-home medications for the patient. And Mr. Vandenberg indicated that the drug, associated with his company is labeled for use up to 14 days in an outpatient setting. So he was recommending a change to that section that said to not allow for more than 1 week of unsupervised or take-home medications. And we did receive a comment from the Ohio Department of Mental Health and Addiction Services and a pretty lengthy rationale from Dr. Trevino that I think, to summarize, as a non-clinician, the safety concerns with patients in this situation, it's not recommended to allow more than 1 week's supply of the medication, even though it may be permitted under the label. They were concerned about safety, I believe, for the patients.
They were concerned about safety and also made the point that the patient's supposed to be seen weekly in any case.
Right. Mm-hmm. Thank you.
Of course.
So is there any discussion here?
HAS, I think I would leave it no change, for that.
Okay. All right, thank you very much. And then the third comment that we received was from Dr. Christine Wilder of UC Health, and she provided a general comment that she didn't oppose the rules, but that she felt that they were too prescriptive and negatively impacted the individualized practice of medicine. She also requested additional guidance for treating alcohol and sedative withdrawal in an ambulatory setting. And so that was also reviewed by Rick Mazzotti and Dr. Trevino at the Ohio Department of Mental Health and Addiction Services. And they recommended adding the language in paragraph E4 of both rules about not driving or operating heavy machinery, adding that to the alcohol sections. And they also indicated import any other relevant guidance from other areas to the alcohol section. I am open if people see things that they would like to have added, but I didn't see anything that readily lent itself to that, but I'm open to any suggestions that board members would have there.
I'm open too, but I also didn't see anything other than E4. So I guess my thought would be you just import the E4 paragraph into paragraph F, like make an F6, or something, and probably just leave it at that.
Okay. Wonderful. Thank you. And then moving on, we have our consult rules finally almost ready. We did receive, and I will also say after receiving so many comments early on in the process, we received very few later on in the process here. So I think that's positive. And hopefully we got, the issues that people had. But we did receive a late comment from Cameron McNamee at the Board of Pharmacy to make technical changes because they are going to be changing their Rule 4729-1701 by the end of the year. So we referenced that rule in 2 places. And so he's recommending that we use Agency 4729, which just allows us to refer to the whole chapter. And so I would like approval to do that. And then finally, we did receive some comments from Sue Chiarello, the legislative chair of the Ohio Society for Respiratory Care. There are a number of respiratory care rules in this package. And we had looked at the comments that she provided earlier on in the process, but she also provided them at the public hearing. And most of the comments are that they were in agreement with the rule changes. There was one in 4761-9-05A1 adding clarifying language about the college credit being limited to respiratory care. And I believe we had already taken care of that during the earlier processes. So the proposed rule does contain language that indicates that the college credit is limited to respiratory care related classes. So I don't think we need to make any change based on those comments.
Great.
So I'd be looking for a motion to make the changes that we talked about to the rules, and then I will do that. And hopefully next month can bring you rules to adopt.
So moved.
Okay.
Yes, Dr. Bechtel.
I was just going to support a motion.
Oh, thanks. So Dr. Bechtel made a motion.
Oh,
Second.
second.
Okay. All right. Very good. And can we have a vote?
Sure. All in favor? Aye.
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 All opposed? Great.
All right.
Thank you so much, Tim.
Thank you very much. I appreciate it.
Thank you so much. So let's move, please, to the Telehealth Committee. And thank you again, Dr. Sohn. Dr. Feibel will now provide an update from the Telehealth Committee, please.
Thank you, Dr. Schottenstein. I first want to thank the committee members who have graciously agreed to serve on this committee. We had a robust conversation on July 23rd. My fellow board members, Dr. Schottenstein, Dr. Bechtel, Dr. Soin, and a new member, Mr. Ganadakis, as a consumer member, we thought was important. So we added him to the committee as well. We basically talked about 4 different areas of the telehealth bill that we wanted to focus on. And the real goal was to put guardrails in place such that we could do telehealth in a very safe and effective manner and protect the citizens of Ohio while we do so. The first area we focused on was the manner in which initial patient visits should be conducted. And we felt as a committee that the initial visit should be in person if at all possible, unless there were very extenuating circumstances for the health and safety of the patient. So that's going to be added to the bill, we hope, and it was a recommendation from our committee. The second area was the standard of care for telehealth visits, and the standard of care is going to be we've recommended that the standard of care be the same as in-person visits, so there be no discrepancy between the two. So if you're going to do telehealth visits, you need to maintain the same standard of care you would have for an in-person visit based on our recommendations. Obviously, both of those provisions would not be in place for the when an emergency is invoked by the governor, as we currently have now. But when there is no emergency, that would be the 2 provisions. The third area was rulemaking authority for the medical board, and we felt strongly that the medical board should have rulemaking authority based on this provision, and that we could set the guardrails in place using our rulemaking authority. There was some discussion about when the rule, because it takes about a year for the rule to go through, there was some discussion about how that all worked, and we're logistically working that out. And then the fourth area was technology requirements for telehealth visits, whether they need to be synchronous and whether they need to be video or not. And we felt that they did need to be video unless, again, there was some extenuating circumstance. The patient didn't have access to video platforms, or was not able to do, for some other reason, was not able to do a video telehealth visit. But the standard of care would be video and synchronous. We're having another meeting later today, and I would encourage any members of the board who are interested to come. This is a very important topic, and a very, I know that many people want telehealth to be in place for the future, and I think it's a good technology to use, but we need to put the appropriate guardrails to protect the citizens of Ohio. And I'd entertain any questions.
Okay, Dr. Feigl, thank you so much for your update. Really appreciate it. If it's okay, maybe I'll give a finance report update. Looking at our fiscal update, you may, if you look on the summary sheet, compare that to the June 2018 revenue of $1,624,136. That June 2018 number was a record revenue month for us. It was substantially a function of the respiratory care therapist and dietitian renewals that were all due in July of 2018. We continue to experience, as Stephanie mentioned, a shortfall in revenue based on the delay of the license renewal deadline of December 1st. We are about $1 million under our projected revenue for fiscal year 2020, and we do hope to make that up in fiscal year 2021. As Stephanie said, there's a small chance that the licensure renewal deadline will be moved back again. It's not impossible, but it's unlikely because, that would substantially cut into the ability of licensing boards to do their jobs without cutting into the general revenue fund. So July 2020 looks a little better so far, more consistent with previous years. And as noted, our cash balance is good at $5,030,208. In your packet, you may see the plotting of our cash balances from 2010 to the present. And even though we are substantially under our projected revenue, we are still at a record cash balance. We should make up our revenue from fiscal year 2020 in fiscal year 2021. And that, as we talked about earlier, begs the question as to whether we should use that anticipated increased revenue for projects at the board, such as a docketing case management software system or the hiring of additional staff to address our backlog of cases. If we do hire additional staff to address the backlog, It would be with the understanding that we would continue to look for inefficiencies in our processes so that we're not just throwing money at the backlog of cases, temporarily addressing that, only to have the backlog come back. If you look at the fines, fiscal year 2020 was our third year of collecting fines. We collected roughly $212,000. In our first year of collecting fines, we collected $222,000. In our second year, we collected $167,000. We had originally estimated about $150,000 per year from fines, so these are good numbers for us. Regarding expenditures, you may see that we had a 0.2% increase year to date, which on the surface of it looks very low. But there are typically 26 pay periods in a fiscal year, and there were 27 pay periods in fiscal year 2019, with that extra pay period representing approximately $300,000. So spending has gone up more than that 0.2% represents. It's probably closer to a 3% increase. You may also notice on the fiscal summary page that for fiscal year 2020, the board spent $107,284 on the historical case review. We had $46,850 left over from our encumbered balance, which we will apply going forward, and that should take us through the end of the historical case review. We don't have any motions for today. Any questions or discussion? Okay, thank you so much. Next, Dr. Safran, if you'd be so kind, will present for licensure committee.
Thank you, Dr. Schottenstein. The first item is Dr. Abu Omar has applied for a medical license in Ohio. He is requesting that his experience and training in the United Kingdom, combined with the experience he has gained as a cardiac surgeon working under the Clinical Faculty Research Certificate at university hospitals in Cleveland, be deemed equivalent to 24 months of graduate medical education through the second year of graduate medical education. The motion before you is moved to grant the graduate medical education equivalence as outlined in 4731.09A4B to be granted a license.
Is there a motion?
I had a question for Dr. Safran. With the Clinical Faculty Research Certificate, was this individual actually involved in surgical cases and assisting and getting experience, or was he in a laboratory, looking at test tubes and things like that?
My understanding that he was involved in both.
Okay. Then I'd like to make the motion.
Thank you.
Thanks. Is there a second? Dr. Rothenberg, thank you so much. Is there further discussion? Roll call, please. Dr. Rothenberg? Sorry, was that a yes?
Yes, sorry.
Okay. Thank you kindly. Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Soren?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarella?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you.
Next is Samantha Beadle has applied for a restoration of her Ohio massage therapy license. She has not practiced within the last 5 years. The motion is moved to approve her application for restoration of her Ohio license contingent on passing the MBLEX within 12 months of the date of mailing of the notice of opportunity for a hearing.
Motion?
So moved.
Dr. Bechtel, thanks. Second?
Second.
Sorry, was that Mr. Jackalone?
Dr. Cockrell, second.
Well, thank you so much. Discussion? Thank you. Roll call, please. Dr. Rothenberg?
Yes.
Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarella?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you.
Please pardon my names, but Dr. Calavente de Almeida has applied for a medical license in Ohio. He is requesting that his experience and training in Brazil and Canada, plus his training at the Cleveland Clinic, be deemed equivalent to 24 months of graduate medical education through the second year level of graduate medical education. The motion before you is moved to grant the graduate medical education equivalents as outlined in 4731.09A4B to be granted a license.
Motion?
So moved.
Dr. Bechtel and Dr. Rothermel, thank you so much. Discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Carrella,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Dr. Dita has applied for a medical license in Ohio. She is requesting a waiver of the USMLE 10-year rule. The motion is moved to approve the good cause exemption to the 10-year rule as outlined in OAC 4731-6-05C2 and accept the examination sequence to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, thank you. Second?
Second.
Thank you, Dr. Rothermel. Thank you kindly. Discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone, Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Caccarelli,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Kathleen Furman has applied to restore her Ohio license to practice dietetics. She has not practiced within the last 5 years. However, her diabetic registration with the Commission on Dietetic Registration, CDR, is current, valid through August 31st, 2021, verifying she meets all requirements and she is in good standing. Our motion is moved to approve her application for restoration of her Ohio license as presented.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, and
Second, Dr. Johnson.
thank you so much. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Caccarelli,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Patricia Guice has applied for a massage therapy license in Ohio. She has not practiced within the last 5 years. However, she has recently passed the NBLEX on April 10th, 2019. The motion is moved to approve her application for an Ohio license as presented.
Thank you. Motion, please.
So moved, Dr.
Dr. Johnson, thank you. A second.
Dr. Bechtel.
Dr. Bechtel, thank you so much. Discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Caccarello,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
myself, Michael Schottenstein, yes. Thank you.
Dr. Nagawara has applied for a medical license in Ohio. He is requesting that his postgraduate training in the United States combined with his experience in India and Australia and his training in the United Kingdom be deemed equivalent to 24 months of graduate medical education through the second-year level of graduate medical education. The motion is moved to grant the graduate medical education equivalence as outlined in 4731.09A4B to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, thank you. Second. Dr. Rothermel, thank you so much. Discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Caccarelli,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
myself, Michael Schottenstein, yes. Thank you.
Next is Kimberly O'Connor, has applied for a massage therapy license in Ohio. She has not practiced within the last 5 years. The motion is moved to approve her application for an Ohio license contingent on passing of the MBLEX within 12 months of the date of mailing of the notice of opportunity for a hearing.
Thank you. Motion, please.
So moved, Dr. Johnson.
Thank you. Second. Dr. Bechtel, thank you so much. Discussion? Roll call, please. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Coccarello?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
Myself, Michael Schottenstein, yes. Thank you.
Dr. Vega has applied for a medical license in Ohio. He has requested a waiver of the USMLE 10-year rule. The motion is moved to approve the good cause exemption to the 10-year rule as outlined in OAC 4731-6-05 C2 and accept the examination sequence to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, Dr. Rothermel, thank you so much. Discussion? Roll call, please. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Coccarello?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes.
Sarah Savage has applied for a genetic counselor license in Ohio. She has not practiced within the last 5 years. However, she obtained certification as a diplomat of the American Board of Genetic Counseling on September 18th, 2009, and recertified on January 1st, 2020 for the 5-year certification cycle ending December 31st, 2024. The motion is moved to approve Ms. Savage's application for an Ohio license as presented.
Thank you. Is there a motion?
So moved.
So moved.
Dr. Bechtel, thank you. Second?
Dr. Johnson.
Thank you so much. Discussion? Roll call, please. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Coccarello?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you.
Pittsburgh Technical College, a limited branch school, has applied for a certificate of good standing for the state of Ohio. The Therapeutic Massage Practitioner Program, 914 hours, 12 months, is accredited by the Middle States Commission on Higher Education, MSCHE, and Pennsylvania Board of Education. The school application has been reviewed by licensure staff. According to the licensure protocols, the listed school appears to be eligible for licensure in Ohio.
So the motion is to approve the application of Pittsburgh Technical
I'm
College.
sorry, the motion is to approve the following limited branch school on the attached list of a certificate of good standing and submitted in accordance with licensure protocols. I'm sorry.
No, thank you kindly. Motion, please.
So moved.
Dr. Bechtel, thank you. And Dr. Rothermel, I think. Thanks so much. Is there discussion? Roll call, please. Dr. Rothermel? Sorry, Dr. Rothermel?
Yes.
Thank you. Dr. Safran?
Yes.
Mr. Jackalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Coccarello?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes.
Last is Mason Anthony School of Cosmetology, Arts, and Sciences. A limited branch school has applied for a certificate of good standing for the state of Ohio. The massage therapy program, 750 hours, 2 semesters, 9 months, is accredited by the Ohio State Board of Career Colleges and Schools, 2020, and National Accreditation Commission of Career Arts and Sciences. The school application has been reviewed by the licensure staff according to the licensure protocols. The listed school appears to be eligible for licensure in Ohio. The motion is moved to approve the following limited branch school on the attached list for a certificate of good standing as submitted in accordance with the licensure protocols.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, thanks. Second?
Second, Dr. Cacarella.
Thank you so much. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone,
Yes.
Dr. Soin,
Yes.
Dr. Johnson,
Yes.
Dr. Cacarella,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you so much, Dr. Safran.
Thank you. This concludes the licensure committee report.
Thank you so much. Next on the agenda, please turn to the compliance section. Do I hear a motion to approve the compliance staff's report of conferences for July 6th and 7th, 2020? Motion?
So moved.
Cacarella.
Dr. Johnson.
And is there a second?
I believe Dr. Johnson second.
Dr. Cagarella, thank you so much. Roll call, please. Dr. Rothermel?
Abstain, I think.
Dr. Safran?
Abstain?
Mr. Jackalone?
Yes.
Dr. Soin?
Yes.
Dr. Johnson?
Yes.
Dr. Cacarella?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Abstain.
And myself, Michael Schottenstein, yes. At this time, we will consider the probationary requests in today's agenda that have been prepared by the Standards Review and Compliance staff and distributed to board members. Before asking for a motion, does any board member wish to consider a probationary request separately? Do I hear a motion then to approve the secretary and supervising members' recommendations for the probationary requests?
So moved.
So moved, Dr. Johnson.
Dr. Johnson and Dr. Cacarella, thank you so much. Roll call, please. Dr. Rothermel,
Abstain.
Dr. Safran,
Abstain?
Jackalone,
Yes.
Dr. Soin,
Yes.
Dr. Johnson,
Yes.
Dr. Cacarella,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Abstain.
and myself, Michael Schottenstein, yes. So other than our FSMB meeting, that concludes the board's business. So I'm guessing we reconvene maybe around 10 till 2, for the 2 o'clock meeting. Yes? Okay.
Yep, we did that.
May I ask something? We have, is FSMB available to meet now?
I'm not sure we can do that just because of having to give notice for these things. I don't know. Maybe, can we? I mean,
I don't know about the notice. I don't think they're available though. We had to work around their schedules for it, but we do have 2 other committees scheduled for after FSMB, one being a discussion about OPHP and one being telehealth. So Dr. Schottenstein, I leave that to you and maybe those committee chairs to think through if we want to take this time to have one of those meetings now.
so
Right.
that would be
Let's do telehealth.
but I'm not sure because we sort of noticed the meetings to start a certain time. I don't think we could go early. I think we could only go later.
I think Kim's talking. Kim, do you have a thought on this one?
I always thought we could change. I think the trick is going to be you're in the full board meeting now. You need to be in the full board meeting for the FSMB, and then the committees are separate. And we have said, and we used to have in our agenda that things can go out of order. I don't know if that's still in there, but we did used to put that in there that things could happen out of order. Since these are committees, perhaps Dr. Schottenstein is correct, though, that we have noticed it for a certain time. It is technically separate. It's not part of the full board meeting.
Yes,
So
that's
maybe
correct.
in the future- Maybe in the future, we'll make sure we have the flexibility because the fact that we're in a full board meeting and then you want to go to a committee, it's easy. We just, those of us who are not on the committee or don't want to sit in on it, we just, back off of the board thing and come back into the meeting when we want to, but as long as we can give us the flexibility going forward in the future, because it's silly to waste a half an hour twiddling our thumbs because we don't have flexibility. Unless, can you check to see whether that could change?
No,
I think it's just general Open Meetings Act issues.
That's, you're right. It's noticed for a specific meeting and it's not part of the board meeting. So I think you're right. But in the future, maybe we can try to build in some flexibility, alerting people that they may, want to build it into our notice.
I think we can do that.
I have a question. Are those committee meetings recorded?
They are.
So I guess just, my 2 cents is if they're recorded, then the public has an opportunity to view it at their leisure. Maybe not live, but I'm not sure how viewing it live versus viewing it recorded deprives them of anything. But I am not an expert in open, committee or open meetings. So,
By the way, who's speaking? Oh, Angie.
sorry,
Okay.
that was Angie. I'm sorry.
To Angie's point,
And I would say we're probably in sort of the Wild West at this point with doing open meetings remotely. So there's probably a number of questions.
to Angie's point, though, the public can't comment anyways on the committee meetings. So the reality is there really is no difference. Actually, it's actually better if they have the video.
That is true. Unfortunately, the law and logic usually don't go hand in hand. The way it's written now is that the public has to have the opportunity to view it live, even if it logically won't make much difference one way or the other. I guess there's always the risk of a technical glitch too with the recording.
Oh, come on.
Or to borrow a phrase from Kim Anderson earlier today, there's not I don't think there's an enforcement mechanism. So that's something to consider as well.
Well,
I don't know what would happen if we had the meeting. I don't think we'll go to jail, but we don't want to break the law. No one does either.
The risk is that anything you vote on is invalidated.
That's true. Yes.
So.
Well, they're not.
Sorry.
They can always at the next board meeting go through the votes and then proceed to the board meeting immediately if there's any question of invalidation.
Right. I mean, there's probably remedies. This is an unusual situation.
All right, so should we just, with that being the case, rather than sitting here, should we just reconvene at 10 to 2? Is that the plan?
Yeah.
Okay.
All right. Nice job, everybody. Thank you so much for everything.
One question, do we have the proper login for
Yeah,
the
I think
FSB?
Krista gave us a second login when she emailed us recently, if I'm recalling correctly.
Yeah.
And again.
Yeah, it was a